It's a pleasure to introduce my friend and colleague Andrew Campbell. Andrew is a leader in hearing healthcare, a master's qualified audiologist who is certified in audiological and neurological sciences, and is a member of the Australian College of Audiology. He's a speaker, teacher, manager, philanthropist, and innovator. He's recognised for the influence in the audiology profession across the world and for his meticulous patient treatment and commitment to patient education. Andrew was a founding member of one of the largest hearing healthcare groups in the country, the founder of New Audio, Hearing and Brain Health, and is also a consultant to numerous independent private practices internationally. I've seen firsthand the impact that Andrew has had on his audiences and his patients. Hearing and brain health is a topic he's passionate about, and I'm sure you'll get a lot out of the program.
We know that the vast majority of people in Australia with hearing loss do in fact never get it treated. Only a third of people that could benefit from treating their hearing loss in Australia ever set foot in an audiologist's office. Of those that do actually take that first step, we know that on average it takes around 10 years for them to actually take action. What the science is telling us is that that's absolutely 10 years too late. What we're going to learn about this evening are the consequences of that delay, what kind of things occur. We also know that those people that do bravely take action, do go and get their hearing loss treated, the vast majority don't actually wear their hearing devices, right? We know how often people are actually wearing their hearing aids. They've got little databases on them, and it's a really important, I think it's the most important job of an audiologist to ensure that their patients are actually wearing their hearing devices on a full-time basis. So there was a major study done just about 4 years ago looking at hearing device use in Australia. And what they found was that a third of hearing device owners don't wear them. They're sitting in the top drawer, right? And if they do wear them, it's for a maximum of 2 hours a day. Completely inadequate. Another third of hearing device owners wear them from between 2 to 12 hours a day. They're what I call my reading glass wearers. You know, they might pop the devices on for a conversation or, you know, watch TV for a bit. The rest of the time they're in the top drawer. Only a third of people that wear hearing devices or that own hearing devices in Australia actually wear them adequately, which is at least 12 hours a day. In order to get the kind of brain health benefits that I'm going to talk about today, the only evidence that we do actually get those benefits occurs when the devices are actually worn on a full-time basis. So if there's just any lesson that you take away from this presentation this evening, if at some time you need hearing devices or you've got hearing devices, they need to actually be worn for at least 12 hours a day to get the full benefits that I'm talking about. Also to get the value and the communication benefits that they bring as well. I'm going to talk about some important research that was done in the United States that was published in 2011. And it was really for the first time hearing, or the field of audiology was involved in a major study of aging which was across multiple disciplines. Audiology traditionally, it's been its own weird little profession that's kind of tucked away in the corner of hospitals and not always integrated enough into, I guess, the broader aspects of aging and what we can do about aging specifically. So this 2011 study was done at Johns Hopkins University, multi-million-dollar study, and it was a longitudinal study, meaning that it went over a long period of time, in this case 12 years. There were 600 people in this study. Part of the selection criteria was that none of these people had dementia at the beginning, and they're all aged around the age of 60, and over that 12-year period, you know, they're aging right through to about the age of 72. Hearing was just a very small part of what they were looking at. They were looking at several aspects many aspects that were known to be associated with aging. Male pattern baldness, the kind of fungus that grows as you get old. Hearing was just a very small part of what they were looking at. Because we know that we have an aging population, and there's a whole host of chronic health issues that come with that. And they're all growing, right, as our population grows. So it's of supreme interest to public health officials, universities, the medical community, society at large. What do we do about our aging population? So understanding the effects of aging is really important. So in this particular study, huge amounts of data put together. What they found was that people with a mild hearing loss, so a mild hearing loss is roughly a 25% hearing loss. When I graduated from university about 20 years ago, we didn't really bother so much about mild hearing loss. We are quite concerned about it in this day and age, given what we now know. They found that people with a mild hearing loss were twice as likely to have developed dementia during the study period relative to their normal hearing peers. They also found that those with a moderate hearing loss, so moderate hearing loss, most of my patients have a moderate hearing loss. It's between about a 25 to 40% hearing loss. Those people are 3 times more likely to have dementia during that 12-year period relative to their normal hearing peers. And those that had a severe hearing loss, those very people that I mentioned at the beginning that had left treating their hearing loss too late for us to get a good outcome, those people were 5 times more likely to have developed dementia during that 12-year period relative to their same age peers with normal hearing. So these are quite astounding findings, and they got onto the front cover of the New York Times, got quite a bit of press coverage over in the United States, not a whole lot of coverage here in Australia. However, I must say that this important topic of the links between untreated hearing loss and cognitive decline are starting to gain traction here, and we're getting more awareness about this here in Australia. You may have seen some things in the media. It's just one of the reasons why I do these presentations, because these messages are really important, but I wouldn't say that they're anywhere near common knowledge, right? So why do people tend to put off doing something about a hearing problem? Well, I think one of the reasons is that the stereotype of the big beige banana hearing aid is reasonably firmly planted in people's minds, right? It's completely outdated. I haven't fit a big beige banana for over 20 years, right? Most of the devices that we work with are if not completely invisible, really discreet and quite sophisticated. So I think that people are putting off taking action partially for cosmetic reasons, right? Of which there's always a cosmetically acceptable solution. Sometimes we've got a trade-off in performance, but cosmetics shouldn't be really a barrier for doing nothing. Another reason why I find that people put off doing something about a hearing problem is for some people it can be an admission to aging, that this is a step that perhaps a senior person would make, and for those that really could benefit from addressing their hearing loss, that delay it, quite often it's because their self-concept hasn't actually caught up with their actual age, right? And part of that does come down to cosmetics as well. What kind of sign is this going to give to the outside world about kind of who I am? But I have to say that most people I see are pleasantly surprised when they see what we can actually do and how discreet and effective the devices actually are. I think another barrier too comes back to the fact that a lot of hearing devices are stuck in the top drawer, and typically people that I see in my clinic are quite well aware of their friends or family that have invested in hearing devices that aren't being used. So for good reason, there's a hesitancy, you know. And typically people that aren't wearing their hearing devices, well, they're not wearing them for a reason, because they're either uncomfortable or, you know, perhaps not set up properly, or just haven't got used to them. So there is a bit of bad press, I guess, about hearing devices. But in my experience, when the correct solution has been selected and the patient has been nurtured through an acclimatisation period to the point where they're keeping them in full time, everything just works so much better. But that's the exception to the rule, right? We know that the majority of people that are being fitted with hearing devices, that hasn't been their experience, and it tends to, I think, dissuade people who really could benefit from actually taking any action at all.
If you're interested in learning more about hearing and brain health, Andrew has written a comprehensive book on the subject. You can download the first chapter immediately by clicking the free chapter link below. You'll have the option to order your own complimentary hard copy as well. We only ask that you cover the cost of shipping. If you're interested in a quick assessment of your hearing ability, we've developed an online test that you can access by clicking the online test link below. Indeed, if you'd like to make a booking for a consultation with one of our qualified audiologists, please click the Make an Appointment link below and you can choose your time and location. One of our customer service representatives will also endeavour to get back to you shortly.